excited to introduce our speaker today, Elizabeth Hallgren. She's working on a really interesting new direct primary care clinic here in Omaha called Mission Direct Primary Care. Let's give her a warm welcome.
Good morning, I'm Elizabeth Hallgren, and I am the co-founder and CEO of Mission Direct Primary Care. We're disrupting the way patients access and pay for their health care by offering a membership-based family medicine clinic. Our flat monthly fee provides access to your doctor when and how you need them at a predictable price. So I think I'd like just to kind of quick show again, has anybody out there ever avoided going to the doctor because they didn't know how much it was going to cost? Yeah, you're not alone. A recent Wall Street Journal poll reported that over 50% of Americans don't go to the doctor when they think they need to because of the uncertainty around cost and then the uncertainty around access. I think we can all agree that how healthcare is right now is broken. Since 2008, premiums and deductibles have gone up more than 2.5 times. And for the first time in 2018, there were fewer people with health coverage than the previous year, 2017. Our out-of-pocket maximums, which is the amount you pay before you get first full dollar coverage on the ACA plans for family, have gone up over $16,000. And an employer faces over $20,000 in annual premiums if they want to try and offer a family plan for one of their employees. Add to that, not super patient experience. So it's right now it's over 24 days to see a specific doctor, and then once you get to see that doctor, you wait over 40 minutes in the waiting room for an average of 12 minutes of FaceTime with that physician. This anonymous and production-based medicine is resulting in 1 out of 3 Americans being referred to a specialist in any given year. That really results in driving costs higher for both the patients and their employers who are paying for their care.
All right, good morning, everyone. It is 11:15. I didn't get a chance to say hi or update you guys until now in the day. Started off my day at, my nose itched. I'm drinking tea because I feel like I'm getting a sore throat, so I hope I'm not getting sick. But I started off my day at about 8:05, 8:10 at 1 million cups, due space 72nd and Dodge. The presenter this morning, I had to make sure I made because the presenter was Elizabeth Hallgren and John Hallgren as well, technically, with Mission Direct Primary Care. Excuse me. They're a direct primary care provider, meaning that Dr. Hallgren is a legitimate doctor, and you pay them a monthly subscription, $99 a month, I believe, for individual, and it caps it at $299 per family. You pay them a prescription. You pay them a subscription, and with that subscription, you get unlimited 24/7 access to your doctor, to Dr. Hallgren, and he can handle, I would say, at least half of the issues that would come up, probably a little bit more. He's not a specialist, so that's the side of healthcare that he does not cover. But he can do annual pap smears, he can do routine physicals, fevers for kids. If you think you might have an ear infection, anything routine and pretty straightforward. They can even cast you up if you break a leg or something. So they could probably more than 50% what Dr. Hallgren can cover. But it's definitely something, shout out to the mirror in the back. It's definitely something that is transforming the healthcare industry, is direct primary care. Again, these guys, Dr. Hallgren is Mission Direct Primary Care. It just really fascinates me to see the creativity and all the new, innovations that are coming out in the field because of the current system and because of the state of healthcare in America as of today, 2020. It was a fantastic presentation. I knew most of it already because I've been friends with those guys for a few months now. I met them through networking. And direct primary care in general is a really good complement to a high deductible health plan or a share program. Those plans are, nowadays, health insurance plans are basically becoming catastrophic plans regardless, because they have such high deductibles where you basically don't have coverage until you hit your deductible. So they're kind of rainy day plans, truth be told. And so if you're just paying 99 bucks a month and you have unlimited access to your doctor for all preventative care and kind of maintenance issues, they can even treat, ongoing treatment for diabetes, just kind of chronic illness management, I guess you would call that. So a lot of people, their health setup now is getting a catastrophic plan or a high deductible plan, and then combining it, I guess, or a share program in this realm, and combining it with a direct primary care service membership, because it's not technically insurance, but together those two kind of make up your health insurance package, your healthcare package and coverage. So it's definitely a big innovation. I always like hearing those guys talk. So yeah, 1 million cups was a huge success this morning. It was very enjoyable. I had to cut that video short because I needed to grab my pork chops out of the oven real quick. But in addition, I think I told you guys a little while back that 1 million cups started doing a 30-second pitch, or I guess you can call it 30-second presentation at the end of every meeting for someone who maybe doesn't have a fully fleshed out business, but they just have an idea or in the very early startup phases of a company. And with the Hallgrens talking about direct primary care this morning, I figured it would be fitting for me to come in and share my business idea that I would like to start pursuing and figure out a way to gain traction on. And my idea is this. It was actually influenced by another member of 1 Million Cups, who is one of my current clients for health insurance. And it started off because she goes, "Colin, I'm buying this insurance from you. I know I needed coverage, but she had to get the cheapest plan possible." And she had to get the cheapest plan possible because what she spends money on for her preventative care, for her health, is chiropractic care, holistic dentists, supplements, vitamins. I think she goes to see a massage therapist and does acupuncture. She's really into yoga. And so that really got me thinking, well, if people are paying for their health insurance already quite a bit of money, why is it not covering the stuff that they're using? And so I was really fixated on this, and ever since I met with her, the cogs have been kind of turning inside. I'm not crazy. The cogs have been turning inside, saying, there has to be some sort of health insurance plan out there that covers this stuff. And I looked, and there is not. The only one that's kind of close is a company out of California called ONA, I think is how you pronounce it, ONA Healthcare. They're a Native American culture company, I guess, and really into kind of holistic care and preventative issues, meditation, mindfulness. But it didn't really do exactly what I wanted it to, or what she wanted it to, and the price definitely was not right. It cost like $430 a month for like a 35-year-old. The only thing I did like is that some sort, like your gym membership and I guess buying like supplements and vitamins are reimbursed up to a certain amount, and that amount actually goes towards your deductible, which I thought was a pretty good idea. But what I'm proposing is some sort of holistic or alternative, whatever you want to call it, not insurance, I don't think it can be insurance, but healthcare membership, where you pay $150 a month, and you always, every single month, get access to one doctor's visit if you need, free of charge, either in person or over the phone, telemedicine. You get one vitamin or supplement, so fish oil, multivitamin, maybe even CBD oil, haven't decided that yet. And there's something else you get. Oh, one sort of essential oil or loose leaf tea. So you get those three things every month: a doctor's visit, essential oil or tea, and a vitamin or supplement of your choosing every single month with the $155 a month subscription or fee. Then in addition, you get your choice of any one of the following. And I'm not looking at my notes, so I don't have it off the top of my head, so I don't have it exactly accurate. But in addition to those first three things, you get any one of the following, and that would be 2 chiropractic visits in a month, a holistic dental cleaning for 1 month, 2 floats, like float spas, 1 cryotherapy session, 1 psychotherapy session or counseling session, what else? 2 massages per month. So along the holistic, acupuncture as well, along the holistic lines of health insurance or health care, that is more considered preventative and also considered kind of woo-woo, that more and more studies are coming out always about how they actually are beneficial. Also, studies show that they're not beneficial, but if it helps those people, who are we to say that doing yoga won't help your mental state or your immune system? That's kind of my thoughts on it. And so that's what the plan would offer. The problem is that I keep running into is the cost. Now, people are paying for this stuff already out of pocket, and because they're paying fully out of pocket and insurance isn't really covering it, it's pretty darn expensive. And so what I think would make sense in keeping the monthly subscription, monthly rate down, is you'd have to have some sort of network. And I hate saying that. I don't like networks, but I think you'd have to make it exclusive, where you can only go to X massage therapists in the city, X acupuncturists, herbalists, etc. So the providers in that sense, the massage therapists, the chiropractors, they would be doing their services at a little bit of a discount in exchange for being one of a couple handfuls, maybe even one of a handful in the city who accept this sort of plan or membership. So then they would have kind of referrals being sent to them all the time, and they would know they would have business because the people that would have this sort of holistic health plan would only be able to go to them or a couple other people. So that's kind of my idea. I went up and I pitched it at the end of 1 Million Cups. Didn't go nearly this in depth, but I got a little bit of good feedback. I mostly just kind of stumped people. No one really knew what to say or what to ask, to be honest. The consensus was, though, that it was a good idea because people are already spending lots of money on this and will continue to, even on top of their health insurance. But again, the issue comes into financials, of course. So if you're paying $155 for this sort of holistic plan, then you have to tack on, a health insurance plan on top of it, or maybe a direct primary care plan on top of that. You easily reach $300 a month for your insurance, which is pretty fair, pretty standard nowadays, truthfully. It's not that much, but people, if someone came to me and said, I have $150, I want your plan, I would say no. Your bang for your buck would always be better getting a true health insurance plan. This would be a plan for those that are doing holistic activities anyway, who might as well pay to get on this plan and get some sort of discounts and added benefits along with their current setup, and maybe add some more variety. Maybe they've always wanted to try massage therapy or always wanted to go to mental health counseling, but have only ever been able to allocate a budget for chiropractic care because they know chiropractic works for them and it helps them out a lot. They just don't have the other finances. With this plan, you can switch off month to month and what your coverage, what your care is going to be that month. So that was fun. I hate presenting. I don't know why. I'm terrible at it. I'm fantastic and good at one-to-one conversations, but when I get up in front of groups of people, my heart just starts pounding and I lose my train of thought. I feel like I did pretty good though. I don't know. I think I recorded it actually, so maybe I'll show a glimpse of it in this video or a later video. But so yeah, that was 1 Million Cups. Then afterwards, I had a one-to-one with Gabe Luce. He's a banker in town. He's also in my Center Sphere chapter. This was our second one-to-one. He's just a great guy, young guy, hungry, very business savvy, really into politics and economic development. He kind of picked my brain on that. He thought that CHI stood for Creighton something, so he was always telling people, yeah, that's the Creighton Hospital or whatever. And I said, no, that's not what CHI stands for. So that was funny. We talked a lot about politics and about Omaha as a city and just kind of the economic development, as well as Project 402. He asked me a lot about Project 402 because he had a similar idea, except some sort of like discounts and coupons that would go along with it. And I said that it would be something that I'd be interested in implementing into Project 402 videos down the road. It is currently 11:35, it looks like, on my watch, and my Wednesday lunch starts in 10 minutes. I'm gonna skip it today because I'm super hungry and I needed to make sure I came home and ate, because the rest of my day is pretty booked. I'll be out and about for the most part, but I hate skipping that. I was gonna try to make it, except the guest that I invited apparently is not gonna be able to make it, so I thought, okay, I'll stay home, make sure I eat well, get energized, and work on some computer work, because otherwise I would not have been able to check my emails or text messages or do any more of that training for the new product I was talking to you guys about yesterday. Wouldn't have had any time to do that until late this evening. So lunch meeting, sad that I had to skip it, but it was for the best. I will talk to you guys after I'm done eating. I think I have a webinar about some new innovations coming to the Medicare space in terms of online applications and just bringing the digital age into Medicare. So after I eat, I plan to do a little computer work, attend that, then I will update you guys later. Something I actually just remembered in my one-to-one with Gabe Luce this morning after 1 Million Cups, we were talking about the changes and trends in healthcare and health insurance, and he brought up Medicare For All, or maybe I did. I think I brought up how unfeasible it is. He leans pretty much the same way I do politically, for the most part, I would say. And a statistic, something that I researched and Googled actually, saying Googled me makes it sound like I didn't research too much, does it? One thing I Googled were the net operating revenues of United Health Group, which owns United Healthcare, Golden Rule, SureBridge, you name it, Oxford I think as well. The operating revenue for them, as well as Anthem, which owns Blue Cross, Wellmark, a ton of other companies as well. Between those two companies, I think it was $480 billion every year. And so I just kind of laughed and thought, there's no way, there's so much money behind not Medicare for All. There's so much money behind Trump and behind anyone who doesn't support, single payer healthcare, government healthcare, and health insurance. There's so much money at stake. Insurance companies could stand to lose hundreds of millions of dollars, as well as, not to mention, the hundreds of thousands of people that the health insurance industry employs every single year. I don't know the numbers on that. I should research that. I should Google that more. GTS, Google that shit. I need to figure out the numbers, but I'm sure it's at least 100,000 people, if not way more, that insurance companies insure not insure. What am I saying? At least 100,000 people that insurance companies employ nationwide. So there's the economic toll, not only in regards to taxes being raised to help pay for Medicare for All and help pay for everyone's health insurance, but also the significant loss of jobs would just destroy our country. So there is absolutely no way that Medicare for All would ever fly. And I hope and pray that that never happens. And I hope that our current administration sticks in office the next election cycle. And I hope that after that, even still, we get people who don't push for programs like Medicare for All that would completely wreck the United States economy. Some new information on that short-term medical case I've been working on the last couple days. She left me a voicemail this morning that I didn't see until over the lunch hour, saying that, hey, my son has special needs and he actually has Medicaid. Will that change anything? I'm like, yes, absolutely, it'll change something. He won't want or need a short-term plan. The short-term plan would not cover any of his pre-existing issues, obviously, and his Medicaid coverage should be pretty darn good as well. Medicaid is always a secondary insurer or secondary payer, I don't know the exact wording, but essentially you can have other insurance on top of having Medicaid. As of today, as of February 26, 2020, case anyone goes back and sees this a couple years down the road and everything's all changed. Don't sue me. But as of right now, you can have a secondary plan in addition to Medicaid, and Medicaid will always pay second. So you pay, your primary insurance pays first and the Medicaid pays second on top of that. However, you cannot receive a tax subsidy from the marketplace if you have Medicaid. You can, basically if you are going to the marketplace and you qualify for Medicaid, you're just not going to get a marketplace plan. That's the whole reason. They just don't want people to double dip, essentially, in two different, call it government-sponsored health plans. She, with that short-term medical case, she also asked, which was a pleasant surprise, she said, wow, that was very cheap, because I think I got her quote for the 4 of her family for like $340 a month. And she goes, wow, that was very cheap, can only lower the deductible down and get to more of the $500, $600 range. I'm just sitting there thinking, man, that's the perfect question. You know, that's the question every agent wants to hear. No one ever asked to pay more, but she thought that she wanted a little bit more coverage than what she had originally asked me to quote her. So that was a pleasant surprise, assuming that she'll take it, of course. Also, it was nice because her son won't be needing this policy. That freed up some more premium space, and I can get her husband and their daughter all the way down to a $2,500 deductible, and that still only costs about $515 a month, and that is much better than the $10,000 deductible that she had, and it's lower than the monthly premium she wanted to stay around. She told me $500, $600, which usually means $600. But yeah, that is a pleasant surprise. A complete change though in direction when she goes, yeah, my special needs son has Medicaid, and I go, that's two things that will definitely greatly impact things, even though she marked on the form that there's no pre-existing conditions or issues with anyone in the family. Must have slipped her mind, I guess. You saw in that clip briefly when I held my hand up, I'm playing with putty. It is to strengthen my elbow. I'm supposed to squeeze it as hard as I can. So it's exercising and strengthening my grip. So whenever I'm just kind of standing at my desk here, I have a standing desk, which I highly recommend. And I also have a chair, obviously, if I feel like sitting down, there's a chair. So standing desks are very versatile, and you lose more calories when you stand. Fun fact. But while I'm just standing around working on my computer, I try to hold a weight in my hand or do some curls or play with my putty. .207, I watched / barely listened to the webinar from 1 o'clock to 2 o'clock. It was not fun or informative really at all. It was kind of a sales pitch from the IMO, from the FML, and just went over very rudimentary stuff. I felt as though it was maybe for new agents, like just getting into the industry, which I am pretty far beyond at this point for being in insurance now. This is 3 years and 3 months, I think, technically, I've been in insurance, which sounds crazy. I'm 23. What a weirdo. Who gets into insurance when they're 20? Oh well. But yeah, it's kind of a waste of time, unfortunately. So while that was going on, I was kind of going through emails and scheduling stuff on my phone. Scheduled a one-to-one meeting with the president of Anchor Insurance for next Monday already. We're going to talk about all things Medicare and kind of some new opportunities in terms of sales presentations that they have lined up, and apparently need someone to run and to be the presenter. They kind of set some things up without having everything ready to go, which is a great opportunity for myself, I guess. They do good work over at Anchor. They've helped me out a lot in terms of training for the under 65 market, as well as Medicare Advantage plans. But I digress. It's 2:09 now, as I've been rambling, and it is time to edit yesterday's video for all of you guys. So it's 8:22. I'm just now getting home. Had a very fun networking event and had an amazing one-to-one. I'll tell you guys all about it in a little bit here. I'm going to shower right now, and then I'll be back. So on the show, I've mentioned before that I listen to YouTube videos on and off throughout the day as I kind of am getting ready and doing menial tasks. One YouTube show that I've been watching in particular recently is Impact Theory. Go check it out if you have not heard of it. It is essentially it's kind of like a Joe Rogan style podcast where they have on people from all sorts of industries, and they just really go in depth in the interview and talk about that individual's field, from mindfulness to fitness to motivation, just all things kind of business and life, and a lot of big names are on that podcast or on that YouTube show. So go check that out if you have not heard about that. It is 10:23 right now, it looks like, and I showered, obviously. I am going through emails and responding to text messages right now. I have been for a little bit, and I plan to continue watching and doing the training for the new share program that I've been telling you guys about for the last couple of days. The name of the plan is Sedera. I don't think I'd mentioned it yet, but it's called Sedera. And they're a unique share program in that they are not faith-based. So people that don't believe in a higher power, or people that don't identify as Christian, are still allowed to be on the plan, which is a new, refreshing take on ACA exempt share programs, which is pretty cool. And the pricing actually looks really good as of right now, as of February 26, 2020. Don't sue me if things have changed in the future. But yeah, I'm going to continue watching that for a little while, and then hopefully read for half an hour, and then head to bed. One of my good friends, Mujan Sharifi, she used to be a financial advisor. I don't think she does that quite so much anymore, but she now works solely at A Cup of Content, I believe is the name of the company. They do copywriting, social media posting, things like that for small businesses. And she is actually subbing for my good friend Nikki Wolf, who is the owner of Assisted Living Locators here in town. She's fantastic. I had a one-to-one with her earlier tonight after the networking group, which was a very good time as well. But Mujan is subbing for Nikki Wolf tomorrow at my Centers for Chapter meeting, so I'm looking forward to seeing her tomorrow morning. In regards to the networking event that I went to, I had no idea what to expect. It was OSRG monthly networking, which stands for Omaha Senior Resource Group, and they are industry exclusive, I found out, except every month they have I guess a sort of open networking event where food was provided, free drinks were provided, and it was an open bar, which was nice, and unlimited food. It was just really cool. I met a couple new people, but I really just more strengthened my relationships with Nikki Wolf, as well as with Alyssa Jelinek. She's actually someone that I've helped out with her health insurance. She works at Right at Home in town, a franchise of Right at Home, a branch of Right at Home, and they do the medical home healthcare for clients that need that type of work done. And I am currently partnering with them to look into a group plan for all of their employees, in addition to bringing telemedicine to their clients. Chelsea Carroll, she kind of sparked that idea in my mind, and it's kind of snowballed into, well, I should work with every home healthcare company in assisted living facilities, and even independent living facilities, to bring telemedicine to the people that need it most, to the people that find it difficult and a task to even get dressed in the morning or any time during the day to go out and go to the doctor. And so I think telemedicine for $20 a month with the company that I am contracted with, very affordable, kind of a no-brainer for those people to tack that on to their current insurance plan, whatever it is, and get unlimited access to a doctor for the minor things and for just prescription renewals, so they don't have to get ready and get out of their house for the day, because it's difficult, for someone that can't walk too well to make it out to go do a typical chore like that. But yeah, the networking group was fun. It was a good time. I met a couple people and built on relationships that I had already established. And after the networking group, I had a one-to-one with Nikki. Again, she's fantastic. She does amazing work and helps people transition in life from kind of living on their own to maybe looking into a facility, a senior living center, either independent assisted living, memory care, the whole shebang. And that's a very vulnerable time for a lot of people, but Nikki does a great job. Had a one-to-one with her, talked about just kind of life and I guess different mistakes that we both made and different ways to send business to each other, as well as just business tactics and networking tips. So that was a good time. But yeah, I will be heading to bed here probably within the next hour, and I will see all of you tomorrow. Perfect timing, everyone. 11:56 p.m. Just finished my February book a few days early, The Happiness Project by Gretchen Rubin. Now I'm off to bed. See y'all tomorrow.